Welcome back. In this video, we'll be discussing treatment resistance in depression, specifically how to manage patients who do not respond to the initial treatment plan. While many patients experience improvement with antidepressant medication and therapy, some individuals may not respond to the first line of treatment. It's important to have strategies in place to address treatment resistance and ensure these patients still receive the care they need. Let's start by understanding what treatment resistance is. Treatment resistance occurs when a patient's depressive symptoms do not improve or worsen despite being on the recommended treatment regimen. This could include medication like SSRIs or SNRIs and psychotherapy, such as cognitive behavioral therapy, CBT. While this can be frustrating for both the patient and the healthcare provider, it's important to remember that treatment resistance doesn't mean failure. It simply means that the treatment approach needs to be reevaluated and possibly adjusted. Step 1. Reassess the diagnosis. The first step when a patient does not respond to treatment is to reassess the diagnosis. Sometimes, the diagnosis of depression might not fully explain the patient's symptoms, and an underlying condition may be contributing to their lack of improvement. For example, bipolar disorder. Patients with undiagnosed bipolar disorder may initially be diagnosed with depression. If treated with antidepressants alone, they may not respond, and the condition may worsen. Comorbidities. Conditions like anxiety disorders, substance abuse, or chronic pain may exacerbate depressive symptoms, making it harder to address depression alone. Medical conditions. Thyroid disorders, vitamin deficiencies, or other chronic conditions can sometimes mimic depression or interfere with the effectiveness of depression treatment. To ensure the correct diagnosis, it's essential to conduct a thorough assessment, including reviewing the patient's medical history, family history, and current symptoms. Using tools like the PHQ-9 or additional diagnostic screenings can help clarify the situation. Reflection. Questions. How can misdiagnosis contribute to treatment resistance in depression? Why is it important to reassess the diagnosis when a patient's depression doesn't improve with treatment? Step 2. Reevaluate the treatment plan. Once the diagnosis is reassessed, it's time to reevaluate the current treatment plan. The following are potential adjustments to make. Medication adjustments. If the patient is not responding to antidepressants, consider the following options. Switching medications. Not all antidepressants work the same for everyone. If an SSRI like sertraline or fluoxetine isn't effective, a different class of medication, such as SNRIs, e.g. venlafaxine, or tricyclic antidepressants, TCAs, may be more effective. Increasing dosage. Sometimes the dosage needs to be adjusted. Gradually increasing the dose of the medication while monitoring for side effects can help improve its effectiveness. Adjunct medications. If the patient is still struggling, adding another medication, such as a mood stabilizer, antipsychotic, or low-dose stimulant, may provide additional relief. Psychotherapy adjustments. If the patient is receiving psychotherapy and not seeing improvement, consider switching to a different therapeutic modality. If the patient is undergoing CBT, it might be beneficial to try a different form of therapy, such as interpersonal therapy, IPT, dialectical behavior therapy, DBT, or psychoanalysis, depending on their needs. Increasing session frequency. For some patients, increasing the frequency of therapy sessions can provide more intensive support and a better response to treatment. Reflection. Questions. Why is it important to reevaluate medication options when a patient doesn't respond to initial antidepressant treatment? How can increasing the frequency of therapy sessions improve treatment outcomes for patients with resistant depression? Step 3. Explore advanced treatment options. For patients who continue to struggle with treatment resistance, it may be necessary to explore advanced treatment options. These treatments are typically considered when more traditional methods haven't been effective. Some of these options include electroconvulsive therapy, ECT. This is an effective treatment for severe depression that hasn't responded to medication or therapy. ECT involves brief electrical stimulation to the brain and can provide rapid relief from depression. Transcranial magnetic stimulation, TMS. A non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain. TMS has shown promise for patients who haven't responded to antidepressants, ketamine or esketamine. These emerging treatments are being used for treatment-resistant depression and are administered through intravenous infusion or nasal spray. They work by affecting glutamate in the brain, which plays a role in mood regulation. These options should be considered after a thorough assessment and consultation with a psychiatrist or mental health specialist. Reflection questions. How can electroconvulsive therapy, ECT, help patients with treatment-resistant depression? What are the benefits of using transcranial magnetic stimulation, TMS, in treating depression that doesn't respond to medication? Step 4. Addressing underlying factors. Treatment resistance doesn't always stem from a lack of medication or therapy. Underlying factors, such as stress, lifestyle factors, or lack of social support, may contribute to the persistence of depressive symptoms. Addressing these factors is just as important as medication adjustments. Consider stress management techniques. Introducing mindfulness exercises, relaxation techniques, or stress reduction programs can help patients deal with external pressures that may exacerbate their depression. Improving sleep hygiene. Sleep problems often accompany depression, and improving sleep habits can have a significant positive impact on overall mood and treatment effectiveness. Building a support system. Encouraging patients to engage in social support groups, connect with family, or join peer support groups can help reduce isolation and improve mental health outcomes. Reflection questions. How can addressing lifestyle factors like sleep hygiene or stress management enhance the overall treatment plan for patients with depression? What role does a support system play in managing treatment-resistant depression? Step 5. Regular follow-up and monitoring. Finally, even when the treatment plan has been adjusted, regular follow-up appointments are essential. For patients with treatment-resistant depression, ongoing monitoring allows healthcare providers to track progress and make timely adjustments. Ensure the patient remains engaged in their treatment plan and adheres to therapy and medications. Provide psychosocial support and motivation to stay committed to the treatment process. Reflection questions. Why is it important to continue monitoring and adjusting treatment in patients with treatment-resistant depression? How can follow-up care ensure that treatment remains effective and supportive for the long term? To summarize, addressing treatment resistance in depression involves a multi-step approach, reassessing the diagnosis, adjusting medication, considering advanced treatments, and addressing underlying factors. With ongoing follow-up care, adjustments, and patient engagement, healthcare providers can help individuals with treatment-resistant depression find relief and continue on the path to recovery. In the next video, we'll discuss how to reassess depression diagnoses when a patient's symptoms are not improving despite treatment. Let's keep it going, and I'll see you in the next one.